is there a subset of treatment-naive patients for whom CNS-targeted agents could be particularly beneficial?
So regarding whether there's a subset of patients for whom CNS-targeted therapy would be particularly beneficial, we think that they would particularly benefit people who have more advanced disease. So in the HIV cascade that Dr. Bartlett discussed today and that many people are familiar with, a high proportion of people in the U.S. still have not been diagnosed with HIV, and when they have been diagnosed, they tend to present later in disease. And that advanced immune suppression in late presenters is associated with a number of complications of HIV, including cardiovascular disease and neurocognitive disease. And so we think it's in this group of people that CNS-targeted therapy may be particularly beneficial. As I mentioned in my presentation today, we have just concluded an NIH-funded clinical trial in Beijing at 2 hospitals in Beijing of asymptomatic people without neurocognitive impairment who were starting their antiretroviral regimens, and we randomized them to either zidovudine, lamivudine, and nevirapine, or tenofovir, lamivudine, and efavirenz. And while the analysis of these results are very early because the study just closed last week, there does seem to be a difference in the arms in developing neurocognitive impairment at 48 weeks and at 96 weeks. So I'm not going to talk specifically about the difference in the arms because we're still analyzing the results. What we have found, what I will say, is that 28% of people who were cognitively normal at the beginning when they started the therapy developed neurocognitive impairment at 48 weeks, 28%, and there is a difference between the arms. So this speaks to the idea that which regimen you choose may alter the development of neurocognitive problems during therapy. So we'll be moving that to publication quickly, and hopefully it will be impressed by the end of the year.